Interesting. From festivities, we move on to development issues, and healthcare delivery is the focus. Another feat in the annals of healthcare delivery in Lagos State was achieved recently with the launch of the Lagos State Health Insurance Scheme. The goal of the scheme, according to Governor Akinwunmi Ambode, is to ensure that Lagosians have unhindered access to sustainable, quality and affordable healthcare services with financial risk protection.
It's a historic day in Lagos as the Lagos State government gets set to launch the Lagos State Health Insurance Scheme. The occasion attracts top government officials led by the Governor of Lagos State, Mr. Akinwunmi Ambode, the royals, party leaders, the governorship candidate of the All Progressives Congress in Lagos State, Mr. Babajide Sanwo-Olu, as well as diplomats, among other stakeholders in the health sector.
And poor health indices.
Before the launch, the Lagos State Commissioner for Health, Dr. Jide Idris, explains the scope of the scheme, describing it as a necessary strategic intervention towards the state's health sector reform.
In the design of the benefits package, reviews of the common healthcare challenges and poor health indices, especially those centered on both maternal and child morbidity and mortality, were carried out to understand the needs of the state's population and inform the development of our benefits package. Accordingly, it includes primary basic health services and selected secondary health services such as treatment and management of malaria, hypertension, common childhood illnesses, antenatal services, delivery, including cesarean section. It is pertinent to note that while we understand that not all stakeholders' needs have been accommodated, it is a suitable starting point, which, as the scheme progresses, will be reviewed, leveraging on more detailed data and information as collated.
The task of providing health insurance for residents may be a tough venture, but Governor Akinwunmi Ambode is happy that the implementation of the policy, which started over 3 years ago by his administration, has eventually culminated into a smooth takeoff.
The Lagos State Health Scheme has come to stay. Robust mechanisms have been put in place to ensure transparency in its operation and in the management of funds. This will help to ensure this initiative outlives any government administration.
Perhaps this is one of the biggest legacies the governor would leave behind as he winds up his tenure. The task of implementation now rests on a successor. The governorship candidate of the All Progressives Congress in Lagos State, Babajide Sanwo-Olu, promises to prioritize the scheme if he's elected.
I'm excited because it's a sector that I can continue to look forward to. So I want to assure all of us that we have started this journey together. We will work it together. All of the budgetary needs that require to keep and sustain it, we will do it.
The scheme also receives commendation from international organizations and foreign governments who indicate their support in order to attain universal health coverage.
And can you imagine that all of these people have the right to good health care, and that good health care should be provided through a system that's efficient and that delivers the health care where it's mostly needed. And that is why we're here today. And that is why we are celebrating actually today, that this is the start of such a program. And I'm very proud that we can assist in that and that we can be part of this healthcare initiative for Lagos State.
After the speeches, Governor Ambode leads some of the guests to unveil the Lagos State Health Insurance Scheme logo, signaling the commencement of the program. The governor also has the honor to be the first resident to be registered for the health scheme. The Lagos State Health Management Agency is mandated to lead the implementation of the scheme.
The premium comes at a cost of 40,000 naira for a family of 6. A family of 6 comprises of the father, the mother, 4 children under the age of 18 years. So it is per year. It is not a monthly thing. It is per year. However, there is also room for additional family members. We do understand our society that some families, nuclear families, are larger than 6. So for additional family members, it comes at a discounted rate of 6,000 naira. However, if you have a child that is older than 18 years of age, that child will be treated as an individual. And the cost for an individual to come into the scheme per year is 8,500 naira.
The advocacy for the health insurance scheme begins with those who have just witnessed its official launch. From here, health agencies are now expected to reach all the local government areas to market and enroll people into the scheme. The state government says residents will start to receive care from the scheme from the first quarter of 2019.
It is on that note we conclude this special Christmas edition of the program. Remember, as we celebrate, let's put smiles on the faces of others, most especially the less privileged among us. See you in the new year. I'm Loretta Chiogo. Bye for now.